Hey, it's Dr. Birchler from Chiro Health Spine and Disc Center. Today's video is going to be most relevant to people who may have some chronic type of health challenge. Maybe you're not sure why you have it. Maybe it's some kind of mystery thing, but something doesn't seem to be right. Whether that's something like headaches, something like chronic fatigue issues, some kind of allergy spectrum, immune spectrum thing, fevers, temperature dysregulation, brain fog, can't think straight, all kinds of scenarios that we have seen. I have this kind of thing come up with patients from time to time with some regularity, and given some of my background in the field of nutrition, Lyme disease, and helping people with chronic illness and figure out how to, what's going on, how to get better. That I've had some significant, experience in helping people do some detective work in this in the past. And the idea here is that, while the body knows things that we don't know, and the body's doing the right thing to adapt us, a person may be deciding on something to do or something to take, or possibly do they need to do something in their home, for instance, something with mold or something like that. And these can be significant decisions. They can be costly in some cases there. And but if it's unknown of really what is going on, it's tough to pull the trigger on those things or do the right thing, or is there something better to do? And so today's concept is on making a health timeline. So really going back, back in time and kind of figuring out when things started, what things might have come into play. And doing this detective work can sometimes make it clear of really what the root cause of something going on is, because the timing seems to fit. And that can give more clarity to a person about why they're having the trouble, and then of course they may get some clarity if there's something in their control that they can do to change, especially environmental type of things, that they can now have a higher level of certainty about what direction to take. So I hope this is going to be helpful to somebody out there watching. I'm not going to spend a tremendous time, but let's jump into some things here. This is a picture of a template that I made here, and just as an example, where we have the timeline on the bottom, and I'll link a version of this here with this video of 10 and 20 year. Possibly somebody has something longer than that going on, but you get the idea from doing these. So it has the time, and then it has a few different factors here. This might not be totally inclusive of every possible thing, but it at least kind of get the mind going in, oh yeah, when did I start that medication? When did I take that antibiotic? Oh, that was the year I got, COVID. Oh, I had a tooth pulled that year. Oh, we moved to a different house that year. We had some work done in the house. I changed my diet. I changed the medication. Got divorced that year. Got married that year. Was pregnant. Had a rough pregnancy, delivery. Had surgery, something like that. So you get the idea. And looking at the time frame of when something started relevant to these things, and especially kind of clusters of things in a certain time frame that may precede the symptom or the illness, are kind of what we're looking for here. So I have always found that a powerful question in this is like, when's the last time in your life you really felt well, like felt healthy? Like, take me back to when is the before this happened. When was that? When's the last time you remember before that happened? And 5 years, 10 years, something. So go back to a time where it's like, I was not having that problem. And then to the best of your ability, narrow in on, I started having this problem around this time frame. And so we certainly want to look at causes that are, somewhat close in time frame, and or preceding that by some length of time. So now we can get into cause and effect on a timeline, right? So that's how to use this. Let me show you an example of a different thing. I just found this on the internet of somebody who was dealing with some Lyme disease type of issues, and so this was just a chart. I'm just showing another example where they're kind of color coding maybe their symptoms and the duration that they had them, when they were worse or better or something like that. Possibly the intensity of it from really bad to good or something like that. they're putting on here, oh, I took antibiotics all these times, and so on. So just another visual example of how you may go about doing that if you want to track a particular symptom on the timeline as well. Maybe you have multiple things going on, and the question can be, do I have a whole bunch of different things, or is it kind of like all one thing, and all these different things I may be feeling in my body are just the manifestations of one primary cause and effect relationship. Okay. So with that in mind, let me just go through a couple categories of things and a few examples, and we'll try to put a more comprehensive list to get the mind going here. But significant health events. For example, somebody getting a vaccination. Both adults and children. So I have seen cases where somebody gets a flu shot as an adult, and then they end up with some weird neurological stuff, weakness, pain, things like that, and really it went back to the flu shot. There was some kind of toxicity effect from these vaccinations, right? Similar concept. Several years ago, had a young gal sick for a year or two, chronic fatigue, headache, no energy. Parents thought possibly Lyme disease or something like that, and got consulting with them, started going through some timeline things like that, and went back and realized that really the onset of the illness happened shortly after getting a Gardasil vaccine, one of these HPV things they make kids, and just ridiculousness, but and just became very, very ill, and ongoing, couldn't do her activities, couldn't be in school, all this kind of stuff. And then several months later, get another dose of it, and got even worse, and really just wrecked this poor gal's life. And kind of confusing until you put it on a timeline and go, oh, that was right, right when we had, the doctor said do this, vaccine thing there. So those are a couple examples that are can be very significant, and I could go for other examples of that as well. Okay. Another thing, dental work. I've seen this multiple times in my career. Had a tooth pulled, and or a root canal, and now I have some swollen joints, some rash on my body, my toes are swollen, my ankle's swollen, got a rash, things like that. Seen those kind of things. Had some trauma to the head, car crash, teeth jammed together in the crash, cracked a tooth, an amalgam filling, came out of the tooth, and maybe mercury, aluminum, whatever in these amalgam fillings, and then a person gets sick and ill from the heavy metal toxicity rapidly leaching out of the dental filling. Okay. And then you could have things like concussion. I got a car crash concussion, sports related concussion, things like that. Medications is a big one. Started taking this medication. There's all these side effects to medications, and a lot of times, even if you tell a physician things about that, they may not put it together. There can be a bit of a bias to not want to believe that the solution, the medication, is actually causing problems and things. So putting it on a timeline. When did I take the steroid? When did I start the prescription medication? When did I start the hormone therapy? When did I take the antibiotic? And so on. You could do a similar thing for herbs and supplements or things as well. Possibly there could be some kind of a reaction to certain things in certain people, allergies to certain type of plant, and so on. Okay. Environmental changes, probably one of the big one I've seen in this. You certainly can have things where person goes into a new job, and they're possibly around chemicals, gas fumes, different things like that. In this day and age, there's quite a bit of awareness, but these things are still out there. Adhesives, chemicals, farming, they spray pesticides and herbicides, and some people are breathing this in. There's all kind of stuff out there with that. All right. One we see is people maybe change residence, and time goes on, having some illness, and but it seems to correlate, after the time frame of moving. And homes can have mold in them, and unaware of that when you move in. You can buy a house, you're renting a house, and you can have these kind of mold issues. And this is something that can be a little expensive to test, can be very expensive to change it. There are some lab tests. You can run urine tests and see other mold spores that show up in the urine. But it's something that happens often enough to be very aware of, that mold in the home is one of those issues that is somewhat common, and for some people, can be a major issue. There might be some kind of epigenetic predisposition to that based on certain enzymes and the body's ability to process things, but there might be a certain segment of people that somehow have more trouble than other people, but exposure to mold is probably a relatively common thing. All right. Certainly dietary things, starting a job, changing shifts, exercise programs, changing diet, all these kind of things, smoking, drinking, caffeine, all kinds of stuff. Okay. Big emotional events, getting a divorce, death of a loved one, getting married, things like that. There can be things that those kind of things tend to be, I guess a shorter time duration. Certainly people can have depression and things that last an extended period of time. Sometimes what we'll see clinically is you have something like that on top of another kind of chemical thing or lifestyle thing, and then you bring in some big emotional thing on top of it, and it's this kind of like everything added together, the perfect storm kind of scenario that creates some type of a health crisis in somebody. So certainly things to be aware of, even though emotions and hormones and things can fluctuate, but they certainly can be a factor in these. Okay. Another thing that we see somewhat common are travel, people going out out of the country. And maybe you go out of the country and they say you got to get a vaccine to go to this country. Maybe you go out of the country, you drink water from a different place, all kind of different exposure to to things. So there's that. Sometimes you're in the water, go on a vacation, go this or that, and in a new place, and swimming, so on, and who knows, you get some kind of waterborne parasite, something like that. We've seen a few different things of that over the years of various types. And one thing that I always ask about, especially when somebody clearly was like, hey, I was doing okay, and then I clearly kind of suddenly started to not feel well. I always try to get the month, not just like the year, but like what month does that happen to be? Like what exact date or narrow range would you say that happened? Now, in my case, I had in 2016 I had Lyme disease, and Lyme disease is a very seasonal thing. It's primarily between June and July, maybe a little bit May and August or things, but primarily June, July are the seasonal times for the acute nature of this to start. And so picking up on some of those kind of things can be helpful. Also, things that seem to be, hey, is it some kind of allergy thing, or is it like an infection thing, or something else going on? Picking up seasonal patterns, man. In October, I always have trouble. Every spring I have trouble. You can start to look at these changes in the environment and the leaves and pollen or things like that. That may be triggers, and that may give you an idea of is there's some kind of environmental and or maybe allergy mechanism or something at play here. So okay, so quite a good list to get the mind going, and we'll put some of these with this information. So for those of you out there, if you haven't already done this and you're struggling, hurting, not sure what's going on, not really sure what the answer is, what we don't want to do is start thinking, hey, I'm not feeling well, and then start medication, some unnatural medicine, suppressive, possibly causing side effects from the medication. And then you add another one on top of that, and man, you get a few of these things, and that really clouds the picture and what's causing what. And so I sometimes talk to people about once you're real deep in this and you start treating things you think are wrong with drugs, and then you get more problems from the drugs. Unless you go back to a clean slate where there's nothing, you're not putting any abnormal chemicals into the body in terms of like medicines. It can be tough to figure out some of these, what actually is your current state, and what is seems to be kind of a baseline environmental thing without possibly some other things coming into the mix and clouding the issue there. Okay, I truly hope this helps someone. We're always here to help you with chiropractic, but if there's something that comes to mind here, or if you feel like, hey, I'm not sure if chiropractic can help, but you need some, need to have, someone to kind of just get you in the right direction there. If you're struggling, we want to be able to help you. You can always come here and see what we can do to help you get pain-free and healthy again naturally.